Cause no one can do it like we do it, like we do it, like we do it. Cause no one can do it like we do it, like we do it, like we do it.
Hello and welcome back to St. Jude in 5. Our special guest today is Dr. Nikolai, and I always get your name wrong. Help me out.
Yeah, it's Bildzukewicz. I usually say like you build a zoo, and like Kevin has an itch, Bildzukewicz. Easier than it looks.
And that's the way you say it. Our Dr. B is our medical director of Foregut surgery, and his clinical interests include the diagnosis and treatment of GERD, hiatal and paraesophageal hernias, and esophageal motility disorders. Welcome. It's good to have you here with us today.
Oh, I love the music, Laura. Thank you for the invitation, and thank you for the opportunity.
Absolutely. So for those of you who don't know, that was the song Danger Zone from a top hit called Top Gun. And I know that you have a connection, right? What is your association with Top Gun?
So prior to coming into surgery, I was a flight surgeon for the U.S. Navy. And so I actually, I was on active duty as a flight surgeon for a little over 2 years. And during my tour, I did spend a total of about 2 months at Top Gun. That was my connection.
So that's very exciting and I think quite amazing. So thank you for sharing that with us today. For those individuals not familiar with foregut surgery, could you explain a little bit about this very special expertise?
Yeah, absolutely. Yeah, it is kind of a relatively new field that's kind of evolving or has evolved over the last 10 years and is still continuing to evolve as its own subspecialty within general surgery. But generally, my specialty focuses on disorders of the esophagus and the stomach. And the term foregut is derived from embryology when the primitive GI tract is developing, and that the beginning part of it, the esophagus and the stomach, is the foregut. Kind of the middle part of the GI system is the hindgut. So the small intestines, the liver, the pancreas, and then the colon's mostly considered the hindgut. So that's generally where the term comes from.
It's fascinating, and I'm thrilled that we have Dr. B with us at St. Jude offering this immense expertise. I know you have a lot of focus on GERD right now. Can you tell us a little bit about what you're exploring in this area for St. Jude and our community?
Yeah, no, absolutely. So I did a lot of, I was fellowship trained in minimally invasive and robotic foregut surgery, and that's kind of what my interests were. And as you know, I was at USC for 10 years, where even prior to my arrival, that was the sort kind of the center of the universe in terms of reflux disease and Barrett's esophagus and esophageal cancer. And while there, I spent a lot of time involved with research and clinical trials and even some of the newer technologies. So my years of experience there, I was able to bring it here to St. Jude and offer it to our patients. So, but as you said, the vast majority of my practice, probably 60 to 70%, does revolve around those patients with reflux disease, specifically those with hiatal hernias and those with complications of reflux, such as esophagitis, strictures, and even Barrett's esophagus, which is a precursor to esophageal cancer. As you mentioned, I do deal with esophageal motility disorders, the main one being achalasia. And then the remainder of the practice is mostly dealing with those with esophageal and gastric cancer. And I work closely with our tremendous medical and radiation oncologists, as you know, in a multidisciplinary fashion. So
that's fantastic. And I think you touched on a lot of it, but is there other things that maybe you see in your specialty as on the horizon?
Yeah, no, absolutely. I think, again, as foregut surgery continues to evolve through national societies such as like the American Foregut Society, we're really trying to build collaboration with gastroenterologists to really advance this field. Previously, there was a lot of hesitation on gastroenterologists to send patients for anti-reflux surgery because of the potential side effects. So also, I think, over the last 10 to 15 years, newer technologies such as the Lynx device and TIF, or the endoscopic fundoplication, have evolved and are growing in popularity. Not only as effective in treating reflux, but they have a better side effect profile than some of the traditional surgeries. So a hot area of interest right now is taking those technologies and exploring their use in patients who are suffering from reflux after bariatric or weight loss surgery. Okay. Reflux is not uncommon following sleeve gastrectomy and even bypass. Also, I think, as you probably are aware, esophageal cancer rates are skyrocketing. over the past several decades. And so the focus is kind of shifting now on identifying those patients earlier in their disease, and several newer technologies that are non-invasive and can even be offered in an outpatient setting are being utilized to help identify these patients and get them over for a screening endoscopy to hopefully slow that progression and allow us to surgically treat their reflux and slow the progression of the cancer at an earlier stage. In addition, I think robotic surgery is growing, whether it's laparoscopic or robotic, all minimally invasive approaches. It's unfortunate the majority of cancer resections in this country for gastric and esophageal cancer are still done via an open approach. But over the last decade, research has started to prove that laparoscopic and robotic approaches are feasible. And I'm proud to say that at St. Jude, as you know, 95% of my cases are done robotically, which is much better for our patients in terms of less pain and quicker recovery. And I guess lastly, I'd like to say, and as you well know, as most areas of medicine are focusing on centers of excellence, right, we're trying to work on building a GERD Center of Excellence here at St. Jude, which is our so-called heartburn center, which will allow us to bring together not only myself, potentially bariatric surgeons, our gastroenterologists that are here, our primary care physicians, and even our gut psychologists, to have the mental health component of it, to bring them in a multidisciplinary fashion to allow us to optimize care for our patients.
No, thank you. It is very exciting to see all of the design, the collaboration, the expertise that we have available at St. Jude. So thank you for sharing. And of course, we're really excited that we recently acquired an additional XI robot to add to our fleet. So that's exciting. And so now I'd like to switch gears just a little bit, and this is an opportunity for us to get to know you a little bit better. So what type of music, when you're just driving down the road, do you love to listen to the most?
So it kind of takes me to the OR, almost like what kind of songs I listen to. So I'll listen to anything from the Beatles to current. All right. So I usually joke in the operating room and say we can put on some gangster rap for me, but that's the one thing I kind of won't listen to. But actually, I've become more and more into country music over the last several decades. I've been sending photos and videos from concerts to my mom, and she's like, I'm glad to see we finally got you onto country. So, because I grew up with it. But yeah, I think if I'm driving down I live in Carbon Canyon, coming down the canyon, so I probably have some country playing.
Okay, I like country also.
Yeah.
Would you say that you are more of a early bird or a night owl?
Oh, definitely an early bird. I'm better first thing out of the morning.
Well, that works well for a surgeon, doesn't it?
Absolutely, yeah.
Good to know. And lastly, what's one movie that you could watch over and over again?
Gladiator, hands down.
Oh, that's not my favorite movie, but that's good. Well, that concludes our episode of St. Jude in 5. Thank you for tuning in today. I'm Laura Ramos. Until next time, St. Jude, stay strong.